Hello everyone, my name is Debbie Creason and I'm the Deputy Clinical Lead for Listening to Action, and I'm with my colleague today, Julie Carden, who is an administrator in the perinatal team, and we've also got Jane Barton with us, who is the Clinical Lead for Listening to Action and Staff Engagement, so I'm sure she'll chip in. I don't know if everyone knows each other, whether we should do a round of introductions just to see who's here. People happy with that?
Lovely idea, Debbie.
Ailish, can you go around the room? Sorry, because I can't, because I've got.
You can't see anyone, can you?
Screen, yeah. I can't see anybody.
Okay, well, I'll kick off. So I'm Ailish Manzoni and I'm an improvement facilitator in the quality team. So Gerke, you're next on my list.
Hi there, I'm Gerke Lange. I'm a clinical leadership fellow and I work with the quality team, quality improvement team, Vedish.
I've got Esther.
Hi, I'm Esther Tyers. I'm the Admin and Buildings Manager with the South Recovery Team at Eastglade Centre.
Georgia.
Hi, I'm Georgia. Currently working in clinical operations, but as of Monday, will be part of the organisational development and staff engagement team.
Congratulations on the new job. I've got Jo Evans.
Hi, yeah, I'm Jo, Continuous Improvement Manager in the Quality Improvement team.
I've got Mike Atta.
Hi, I'm Mike, one of the consultants in the South Recovery team, and I've been following similar people through all sorts of conversations today.
Yep, got Richard.
I'm Richard Mills. I'm a non-exec director on the board, so that means I'm one of the part-time members of the board. I've been in the trust for 6 years and been working virtually since March, so I haven't been in the office since then. And this is my 4th session today, and I found them absolutely fascinating, and there are some common themes. And I'm a keen supporter of listening into action and the 7 steps, so good on all of you.
Thanks, Di.
And we've got Robert.
Hi, good afternoon, everyone. Rob Nottingham, Business and Performance Manager, working across Nursing and Professions Directorate.
And finally, we've got Zaid.
Hi, good afternoon. I'm Saeed. I'm the Ward Manager for Fertile Rise Assessment Treatment Service.
Hi.
Okay, so I think that's anyone. If I've missed anyone, just shout up.
Okay, great. I'll make a start then. I guess everyone's had time to read the introduction page, so I will start the presentation. So I'm going to start, and then I'm going to pass on to my colleague Julie. So we're here today to talk about listening into action 7 steps. Essentially, and this isn't new, novel, or groundbreaking in any way. 7 steps is a methodology, a way of enabling change. So it starts off with a great idea, and then we support that great idea to take flight and come to fruition. So I'll talk a little bit about how it works. I'm going to deviate from this slide a little bit because I don't think it flows particularly well, but this is the presentation that is from Listening into Action itself. So it starts by an idea, and it can be simple, it can be complicated, but it's something that somebody wants to change, a possible problem that's been identified, and people want to come together to make a difference and make that change. So we start by speaking to that person and talking about what it is they want to achieve, and then ask them to think of other people that they'd like to work with. So 2, 3 or 4, 3 passionate leaders that can help make that change. And those people will be motivated and will drive the change and will be dedicated to making it happen. So then we organise a big meeting for a number of people who want to progress with a 7-step project. And the reason we do that is because, so we've done this once, is that enables people to build relationships across different levels of the organisation. It develops curiosity between people. So if I think we had about 10 teams last time we ran the 7 Steps cohort, and people were dotting between the tables trying to find out what other people were working on and realising that they could help each other. So during that session, we do a number of things. We ask them to think about what it is that they want to change, why they want to make that change and what they want to achieve, and how they're going to make that happen. So I'm going to give 3 examples, and then I'll hand over to Julie for her to talk about what she's been working on. So I'm going to start with the physical health clinic.
Oh, can I stop maybe for a second? Sorry. Could you just pop it on slideshow so the slide comes up a bit bigger?
I was going to flick between presentation and Word document.
Right.
Is that okay? It doesn't matter that you can't read this.
Yeah.
Because that's not the most important part. Okay. So I'm going to flick now to the work that, excuse me, that Cert did. Can people see that?
Yeah.
Yeah,
Just, sorry. So essentially, Cert is the Community Enhancement Recovery team. They're a team that provide a service that's an alternative to inpatient rehab in the community. And one of the things they do is a physical health review every 12 months. Now, they're pretty good at doing it, but they do fall behind sometimes. And what they felt was the assessment wasn't always the best it could be. And then the interventions offered after weren't the best that they could be either. So what they wanted to do was improve the physical health of service users, improve their access to physical health monitoring, provide the better intervention by giving lifestyle advice and signposting, and developing individualised care plans that meet people's health and well-being needs. So then they talked about why it mattered, and they identified that premature death in service users was prevalent with people with severe mental health problems. There's often limited access for physical health care and treatment, especially for a client group that can be hard to engage or find it difficult to access physical health care. And there is a higher risk of preventable and treatable physical health conditions. So between them, they identify people in their team. So that's a doctor, recovery worker, the team managers and recovery workers. But then the next process is about identifying people outside of the team that can make that happen. Now, one of the main functions of the Listening to Action team is to support the change and try and help people unblock any blockages that occur, not cause blockages, try and unblock blockages. So they met, and then they went away, and over 20 weeks they met very regularly, and they've developed a physical health clinic to meet their needs. So now that physical health clinic is held every Monday. It's facilitated by recovery workers and a nurse, and they schedule in people's physical health reviews, but then they also plan in the interventions after that and allocate it to other members of staff. So their physical health reviews have improved massively, and especially the interventions after. So it's more meaningful and it's more personalised. Okay. So the next group was the peer working group. I realise I've not got a lot of time, so I'll go a bit quicker. But essentially, there was a few people that got together. What they understood at the time was that there was a bit of disparity in terms of peer working roles in different teams and services. So they wanted to develop an understanding of what people's understanding was of the peer worker role and how it was used in teams. And of course, it matters for improving retentions of peer workers and improving people's well-being, and it's better outcomes for service users and delivering the people strategy. So at the event, they came together and went away and again met regularly, and they put together a questionnaire to understand what people's perceptions were. And then they brought all that information and presented it as a group. So they're continuing in their work, and they now want to kind of make changes based on the information that they found. And then another example I'm going to use is the Walking Alongside Lived Experience Mentoring Group. So it was a group of like-minded people that worked in different parts of the organisation. One of the good things about this is you can bring together people from the same team, or you can work across teams, and that really helps building that kind of understanding and knowledge of different people and different services. So they wanted to develop a program where they could support people with lived experience by people with lived experience. As they compiled their kind of their aim and what they wanted to do, we'd just hit lockdown. So some of the things that they identified was that people with lived experience, if they were working from home or shielding, it could be quite isolated. People could be feel less connected with people that they work with. There's obviously a high absence rate due to COVID and work-related stress. And they wanted to make sure that people felt supported and happy and had somebody to talk to and help them work through some of the issues. So again, they went away with key people, and now they've developed a lived experience mentoring coaching program, which fingers crossed should be available to find out more on the intranet. If it's not there, it will be there soon. So if you let me know, I'll let you know where you can find more information. Okay, so I am going to pass over now to, oh no, I'm not, beg your pardon, sorry, I've got another example. So this is the Green Wheels team. I added this in last minute because I wanted to include it because it's very current. So they started initially by a few people, and then it shifted focus, it shifted, the core group moved. And initially the hope was that people wanted to think about sustainable transport. So people came together, and like I said, the focus shift, and what's happened as a consequence is they have developed a brilliant pilot of using e-bikes in the CERT team. So it started on Monday, and this is why it's all very recent. They developed questionnaires for staff that were going to be involved in a pilot, measuring lots of different things around their travel, around how many miles they travelled, what methods of transport they used, how that impacted on their health and well-being. And then we're able to access e-bikes from, the company escapes me, but we access a number of e-bikes that people were going to use either independently, so people were given an e-bike to use for work and for personal journeys, or there was a set of pool bikes, so people that, for example, travelled from Doncaster, it might be a bit far for a novice cyclist, then could use it to go on service user contacts during their working day. So if you watch out and connect, you'll find out how that pilot's going, and the hope is that that can then be offered out to staff across the organisation. Yeah, so now I'm going to hand over to Julie Carden, who is here to talk about improving opportunities for admin staff, and she can give a much more detailed example of some of the work that's been happening. So I'm going to switch control, if I can work out how to do that.
I'm going to just share my screen.
Okay.
Can you see that?
Yes.
Fabulous. Yeah. Sorry, just get everything ready on my end. So I'm Julie, and I've been working with a group of ladies, Louise Jordan, Julie Pratt and Stephanie Wilcock. We met together in February at the launch of LiA. Louise had put together a suggestion for a group to improve opportunities for admin staff in terms of development and career progression. And that was something that I was interested in. So I jumped at the chance of being involved. So our aim, that didn't switch on, did it? I flicked on, but it hasn't changed on screen. Sorry.
Sometimes it just takes a little while, Julie. We've been having that.
One second. Sorry. So we got together and we set out the aim to set up the group of to look at, training and development opportunities for admin staff, because we were passionate about it and we wanted to improve opportunities for admin. What we discovered is that there's a kind of like a ceiling in terms of band 4, and it's hard to to get past that. And we also just wanted to make things better. We had sorry, it's not working, it's not moving.
Do you want me to share my screen again, Julie?
Yeah, please. It's just not flicking on at all here.
You see that?
Yeah.
Okay.
So we're on this slide. What did we do?
Yeah.
So our mission was to improve opportunities in training and professional development to aid career progression for admin staff in the trust. And it mattered for job satisfaction and improving morale, and we want like staff retention, personal development, so admin staff would feel more valued, and to also improve efficiency. And the people that we needed to get involved was the training and education department, IT and communication, finance, and obviously we wanted to involve other admin and get their feedback. So the next slide then is we had a focus group in March where it was attended by about 40 admin. And in that, we looked at the perceived barriers and how things could be improved. And the session was like really informative, and it like shaped the direction of our project, because what we realized that there was pockets of opportunity in existence, but not all admin were aware of how to access these, like such as Annex 21 apprenticeships. There was limited access to external training. Like different departments had access to private training or had membership with private training companies. But various people knew, various people had different knowledge. And another thing that came up was the poor advertising of these admin opportunities. There were either were given examples of items being out of date, or sign up within a day or 2 days, or short notice. So that was something else that we wanted to work on. So following excuse me, following that, we liaised with Steph Allen, because what we wanted to pull all the information that was already in existence. We wanted to pull that together, so that there could be one place for admin managers to go, and when it came to PDRs, that people they knew where to look to when people were looking for training, or to help identify development opportunities. We also our plan was to meet Philip Simon to discuss having a widget or a place on the intranet, and also about improving the advertising of the training, and to liaise with James Sabin in finance to discuss access to courses that finance currently utilised and to inquire about available funding. But one of the biggest things that we took away from that day was that admin staff did not feel like their work was valued and that there was a lack of encouragement and support from managers. So following that, we met again shortly after that. Well, actually, I think COVID happened. We met after COVID, but following that, that was our biggest takeaway. And what we wanted to do was like, how do we measure this? How do we make sure that that what we're doing is improving staff morale? So what we did is we contacted Liz Johnson, Head of Equality and Inclusion, and we asked if she could pull some information from the staff survey to see how admin staff results compared to other staff groups. And we asked a number of questions. And to be honest, the results of the survey were in line with what we expected following our focus group in March. So I don't know, Debbie, if you're on the same slide as me, I'm on slide 14. So the questions here were any training and learning or development needs identified? So admin and clerical was 55%, the national average was 69%, and our organisation overall was 66%. One of the others, have you had any training, learning or development in the last 12 months, not including mandatory training? Admin and clerical was 62%, our organisation overall was 75%, and the national average was 73%. I will probably look for a job at a new organisation in the next 12 months. Admin and clerical 29%, national average was 19%, and our organisation overall was 24%. And as soon as I can find another job, I will leave this organisation. Admin and clerical 19%, the national average was 12%, and our organisation overall was 16%. So I think you can see there that, you know, it's something that we obviously want to improve on. Admin was below national average in all cases, and we need to improve that. So what we're doing right now is we are really focusing on the internet and getting all that information together. We want to, what we're doing at the moment is we're developing content. So we're speaking to people that has started off in like band 2 and band 3 admin roles and have worked their way up in the trust, and kind of some inspirational videos and see how people did it. Speaking to past apprentices and where they are now. We are also looking at having like defined career pathways, so that like any staff, if they look at where they are and where they want to be and the steps they need to take to get there. So all this stuff we're developing for the internet, and we're liaising with comms to have that in one place. We're also looking to liaise with STH because they have an admin professions program, the premise of which is valuing admin as a career pathway with proper training, support and a route into more senior roles. So we want to kind of find out more information about that and find out if there's things that we can access in STH, or if not, if it's something that we could replicate here in the trust. And also something like we realise that this LiA little group started off as a 20-week span, and the work that we're doing will far outlive the 20 weeks, and it's something that we're really passionate about and committed to working on improving. So we do have plans for other stuff once we have the intranet up and running. So yeah, that's if anybody wants to get involved or wants any feedback or wants to give any feedback, please get in touch. That's my email address, Julie Carden. So thank you.
Thank you.
And if anybody has an idea that they want to progress through 7 steps, then please come forward, or if you know any colleagues that that have a gripe or want to change something, then we can support that. We ran a cohort earlier in the year, and we advertised for a second cohort, though we had limited interest in that, and I think it's probably reflective of the current time. We are supporting a group just on its own, and that's around digital distractions, and we're supporting another group as well around animal assisted interventions that's just taken off in between cohorts. We do hope to run a cohort probably a little bit after COVID's settled down a bit, because there is real value in bringing people together to work on a change, but we're not letting that stop us. So I think we've got a couple of minutes left, so I will just come out of this, and if anybody's got any questions, we will try our best to answer.
Yeah, Jane, you have your hand up.
Just to add, thank you for that. That was great to hear everything. But just to add that the work has been possible because other people as well in the trust have helped to enable it. Like Julie, you described all the people from other departments, and I think it's just about recognising that. And even if people who might be on the session today don't particularly want to lead on a 7 steps project, that's fine. But if they feel that the area that they work in, they could potentially support other groups to enable them, then we really do rely on what we call like enablers to come forward. And the event that Debbie described that we had launching this back in February, we had at least 10 or 15 enablers from across the organisation who were there on the day to work with groups as well. So we really value that. Thank you. Thanks, Debbie and Julie. Richard?
Yeah, can I? Yeah, I'm Richard. I'm one of the directors. I think it's really important that we keep this work going, and I know COVID, unfortunately, is going to go on for quite a few months more, I'm afraid. But I think we need to find ways of keeping it going and keeping people energized, because the issues you're raising are issues that keep coming up, that have arisen in other sessions I've been on today about how we keep communicating and how we find the time and the space to move on and keep developing. So I think it's vital that we don't lose momentum, and that we keep the LiA methodology going as well as the other things. So, I think the board's probably not tremendously cited on this at the moment either, and I wonder if we need a reminding that of the good work that's been done. I mean, the admin stuff that Julie's highlighted is absolutely, so it's stark, and it shows a really significant issue that we probably haven't been cited on at all. So it's vital work, and I think we need to I really support keeping it going and poking it with a stick every now and then, really. Thank you.
Thank you. Gerke?
Yes, hello, thank you, Debbie. I'm aware of time, so very quick, just to also echo, I really enjoy especially I think that event, that initial event where people came together, the different groups, and having different professionals kind of supporting. So, I was part of the peer support project, and, we had Caroline Perry from HR there and the peer support workers, which was incredibly valuable actually to be in a room, have the time together to start the thinking off. And also obviously, I came from a quality improvement background, so to bring that to the project. So it really highlights the importance, of how valuable it is to bring people from all different areas of the organization to make changes.
Yeah, thank you. Jane, have you still got your hand up?
I'll put it up again. I suppose just link on the back of what Gerke's saying, it relates to that, but I just really wanted to comment really about the partnership working of what we've been doing through like Listening Into Action and the quality improvement team and wider service. And I think just to acknowledge that, because I think, you know, when Listening Into Action first started in the trust, I think some people were thinking, well, you know, how does this link with quality improvement? How is it different? How does it whatever? And just to say that, you know, we've been working closely together on this, and I know Joe, you're on the call. You've been part of helping us to launch all of this as well, and just seeing it as another arm really to how we improve things in the trust. So just recognising that collaboration again. Thanks. Thank you.
Thank you. I think Debbie's disappeared.
Oh.
Yep. No, am I here?
Yeah, you're here.
Okay. Sorry. Yeah. Are there any other questions? No, that's great.
Thank you.
Well, thank you, everybody.
Thanks very much.
Have a lovely weekend.
Okay. Thanks.
Thank you.
Bye.
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 Julie,
Thank
hang
you.
on.
Bye.
Yeah.